Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with exam success. Now, I've been doing this since 2015, assisting nurses and nurse practitioners internationally. You know, I always like to give my disclaimer and reminder that we know there's no absolute medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any videos that I do, if I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get started. Last call and reminder for our upcoming practice question course on July the 13th, a virtual live course from 10 a.m. to 11:30 a.m. Eastern Standard Time. It is $49. I have one space remaining. After that one space is enrolled and registered, it will close out the enrollment. Otherwise, it will end on Wednesday for everybody to be able to be enrolled, okay? And so that I can get everybody the things that they need for our actual class on Saturday. During this class, I will walk through the exam breakdown of the ANCC as well as AAMP for family and adult general reviewers. We will work through practice questions live together. I will show you how to answer each question type, give you test taking tips, and allow for Q&A to answer any of your questions live at that time, okay? All right, let's get into our questions, you guys. All right, so one of you guys reached out to me and asked me to cover ulcerative colitis and Crohn's. So we'll do a few questions today to help you tie these things together, okay? So question number one states, the nurse practitioner and the NP student are discussing ulcerative colitis and Crohn's disease. The NP student inquires on the difference between the two. What is the best response by the nurse practitioner? Is it A, there's not a difference between the two? B, inflammation is localized to the colon with ulcerative colitis? C, inflammation is localized to the colon with Crohn's disease? Or D, Crohn's disease is localized to the esophagus? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the best response by the nurse practitioner? So what are we even responding to? The nurse practitioner and NP student are discussing ulcerative colitis and Crohn's disease. The NP student inquires on the difference between the two. So your best answer here is B. Inflammation is localized to the colon with ulcerative colitis. Use your med terminology when in doubt, but we know itis means inflammation, right? Colon, so inflammation of the colon. But just paying attention to this, that with ulcerative colitis, that inflammation is localized to the large intestines, the colon, right? Whereas with Crohn's disease, the inflammation can be throughout the entire GI tract. Okay, so there can be inflammation all throughout, from the mouth all the way down throughout the GI tract. Okay, so don't get that confused. All right, question number two. The nurse practitioner is reviewing the patient's medical history and notes there was documented cobblestone appearance of the intestinal tract. What diagnosis would you consider with those findings? Is it A, diverticulitis, B, ulcerative colitis, C, Crohn's disease, or D, appendicitis? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states, what diagnosis would you consider with those findings? Y'all know I always say, when being asked about a diagnosis, you need to run it back and see what the assessment findings are so that we can figure out what we have, right? So here, the nurse practitioner is reviewing the patient's medical history. Is documented of a cobblestone appearance of the intestinal tract. This is one of those scenarios that I say, Brittany's brilliance. When I say this, you say that, right? Because in practice, on boards, when you see a cobblestone appearance of intestinal tract, when I say that, you should say, Crohn's disease. Crohn's disease. So I always say, think CC, right? So cobblestone appearance is one of those classic presentations of Crohn's disease. Again, back to where we started. Because of the patchy inflammation all throughout the GI tract, you know, from mouth to anus of the potentials of where it can exacerbate or have this. With the barium appearance, if you picture like a cobblestone road or whatever, a cobblestone walkway, it's like bumps, but you can see those the lines, the cracks between the bumps in the cobblestone, right? Well, with the barium seeps through those cracks around the inflamed regions and those like patchy inflamed areas, and that's where they get that cobblestone appearance description for Crohn's disease. So when you think about cobblestone appearance in the intestinal tract, I want you to think Crohn's, CC, okay? And then lastly, question number 3. The patient presents to the office with complaints of abdominal pain and diarrhea with some blood noted. The patient states that they have had weight loss over the past 2 weeks. Upon examination, the nurse practitioner notes that the patient is febrile. While attempting to rule out ulcerative colitis or Crohn's disease, what is the best differential diagnosis at this time? Is it A, ulcerative colitis, B, Crohn's disease, C, neither Crohn's nor ulcerative colitis, or D, more testing is required? Take a moment and tell me what you got. Tell me what you got. All right, so here, stem of the question states, while attempting to rule out ulcerative colitis or Crohn's disease, what is the best differential diagnosis at this time? All right, so again, we're still trying to figure out a diagnosis, right? And so you got to run it back and look at the assessment findings. This patient has come in, they're complaining of abdominal pain, they're having diarrhea, there is some blood in the diarrhea, the patient has had weight loss, and the patient has a fever, right? Now, let me explain. Abdominal pain, fever, weight loss, diarrhea, all classic for ulcerative colitis and Crohn's, disease in their presentation. So that's where we come to this trying to rule out one versus the other of our differential diagnoses. But one of those things that stands out is the blood, right? In the diarrhea, the blood in the stool. Bleeding in the stool is more common, I should say, with ulcerative colitis, okay? It's more commonly noted in ulcerative colitis versus Crohn's disease. Not to say that you can never see blood with Crohn's disease, because you can, but ulcerative colitis is more commonly associated. So when you see bleeding in that, that's your best differential at that time until any further assessments or things are ruled out. Okay, so your best answer here is A, ulcerative colitis. All right. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And make sure you meet me back here. If you need any other resources that I offer, feel free to reach out to the nursing studio at 803-400-6864. You can also shoot a text message to this number, or you can shoot us an email to the nursing studio, the number 1 at gmail.com. All right, you guys, a few things that I offer are the review book. That is either in the ebook option or the paperback option. Both are linked in the bio of this channel. If you're looking to do a self-paced review course that is on demand, designed for family and adult Gero for both exams, including a non-clinical section in this, that is linked in the bio of this channel also. We have our 5-week reviews. The next group 5-week review is starting in September. And then we offer our one-on-one sessions. So with the one-on-one sessions, you can book to cover a weakness. So for example, you're struggling with asthma and the stepwise approach, then you can book a session for us to go through that, to get the feedback, for me to help you walk through it, and to get the breakdown sent to you as well. Or if you're just trying to see if you're ready for exams, if you're ready for boards, you can do the exam readiness assessment. Or lastly is the custom plan. Say you've been unsuccessful before, or if you just simply don't know what to do and how to prepare, then you can book this custom plan. It's based on how long you want to prepare for boards. I gauge your initial, where you are with the initial pretest. And then we set out and structure a study schedule based off of the duration that you want to prepare. I work alongside with you during that time frame and get you prepared for boards so that you can be successful like the rest of the nursing studio crew, right? All right, you guys. And if you are trying to claim that last spot for the practice question course, make sure you grab it. It's linked in the description of this video. But y'all make sure y'all meet me back here. Happy studying. Bye, y'all.